Welcome everyone. Thank you for joining us today. I'm Theresa Marentette, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. For those of you who are awaiting test results for COVID-19, you can now obtain your results online. Please check the Ministry of Health's online portal or the link on our website. Please note that at this time our health unit will continue to follow up with you directly to provide your results. With the number of tests pending, results may take up to 4 days. Once you have received your results, you will be given instructions as to next steps. Please remember that while you are awaiting your results, you must remain in self-isolation. Overall, 4,468 individuals have been tested for COVID-19, and of those tested, 605 tests are pending. I will now share the most current case counts. There are 38,422 confirmed cases of COVID-19 in Canada and 11,735 cases in Ontario. Chatham-Kent has 31 cases and Sarnia-Lambton has 150 cases. Michigan now has 32,967 cases with 7,904 of those cases in Detroit. Today, we are reporting 518 cases of COVID-19 in our community, an increase of 12 cases from yesterday. 42% of our cases have occurred in long-term care homes, including both staff and residents. 93 cases have recovered, 26 people are in hospital. 18% of our cases are between the ages of 50 and 59 years, and 23% of our cases are people 80 years of age or older. 39% are male, 60% are female, and 1% are unknown at this time. Our community has lost a total of 31 people to COVID. 22 deaths have occurred among residents in long-term care and retirement homes. Our health unit continues to work with 6 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. Testing for COVID-19 is based on a clinical assessment. Symptoms include fever, cough, difficulty breathing. However, other symptoms may be present, such as being extremely tired, falling, nausea, vomiting, chills, headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, complete the online self-assessment tool, contact Telehealth Ontario, or call your primary health care provider for a phone or virtual assessment. They will be able to guide you in next steps, including contacting the public health unit or attending an assessment center. Please be reminded that Windsor-Essex residents can now access a virtual walk-in clinic by going to ehealthwindsoressex.ca. As well, Windsor-Essex has 2 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. This includes healthcare workers, caregivers, care providers, and first responders, residents and staff in long-term care facilities and retirement homes, and residents in the community referred for testing by the health unit or their primary care provider. Please continue to visit wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. As resources in public health continues to focus on the impact of COVID-19 in Windsor and Essex and across the world, there remains a separate public health crisis, which has been ongoing for several years now. The impact of opioid and other drug use in our community has taken a devastating toll, and the efforts of the Windsor-Essex Community Opioid and Substance Strategy Leadership and Working Group have sought to minimize the harms associated with drug use in our community since its inception. While meetings of the strategy have been on hold or held informally over the past month, the efforts of VCOS partners to support people who use drugs their families, and those with concurrent mental health and substance issues should be acknowledged. Organizations such as the AIDS Committee of Windsor, the House of Safra Hotel du Grace Healthcare, Canadian Mental Health Association, and the RAM Clinic of Windsor-Essex have worked tirelessly to ensure that those people in our community who depend on harm reduction equipment, medication, assisted therapies, and counseling have what they need in this difficult time. By shifting operations to provide alternative options for their service, such as virtual counseling, these organizations have helped to avoid additional overdose-related harm over the course of this pandemic. During the COVID-19 pandemic, persons who use substance are at a higher risk for, number one, COVID-19 transmission due to the practice associated with drug use, such as sharing equipment, using in close contacts with others, leaving the home to access drugs, and other increased risk of negative outcome associated with overdoses, such as substance use can impact their breathing, which we know opioid does, and it can have an impact, and combined with COVID-19 can result in more severe outcome in those individuals. It can also lead to risk for dependence during this pandemic, as people looking for anxiety and depression can resort to using drugs and can develop dependence due to it. In recognition of these risks and general information on our wichu.ca website, the Windsor-Essex Community Opioids and Substance Strategy Partners have expanded the content of wcos.ca webpage for people who use substance, healthcare and social service providers, pharmacists, and the general population, specific to the intersection between substance use and COVID-19. This enhancement is for anyone who is live now, and anyone interested can visit our website, wcos.ca, to learn more about it. Some of the new changes new content that has been added on our website includes what we know about people who use substance with specific needs and maybe at an increased risk of COVID-19 due to a number of physical, social, and environmental reasons. The new content outlines some of these reasons based on the best current evidence. It also includes key messages for people who use substance and those who support this population during the COVID-19 pandemic. These messages include information about safer drug use to prevent COVID-19, importance of hand washing and social distancing, and continuity of care and contingency planning needed to ensure people who have support. The website also includes where to get help and a list of available local services and online supports for people who use substance or those seeking treatment are available there. It also includes interim guidance documents for healthcare, pharmacists, and harm reduction workers who work with patients or clients that need more specialized information to support clients during this time. The WCOS website will be regularly updated with timely and relevant information. Please visit our website if you're looking for more information on people who use substance use. Switching topics now, with the start of Ramadan in the next couple of days, the WICHU would like to remind residents that Ramadan is a holy month for Muslims. Similar to my urgings during Easter and Passover, I ask everyone to follow the practice of physical distancing during this holy month and avoid social gathering for more than 5 people. This month of fasting, combined with a special prayer, is very important to all Muslims around the world, but we cannot ignore the important lesson of self-discipline in this month. Please practice physical distancing as much as possible and do not gather in more than 5 numbers. Thank you.
Questions from the media. We'll start with AM 800.
Yeah, I was just wondering, this is the, I think, second time now that during your morning briefing there hasn't been an additional death to report. And, the number of cases that we are seeing seems to be slowing down. Is this encouraging to you, or what do you take away from this?
So it's obviously it is encouraging to see no death in the community. That's the goal. As far as the number of positive cases is concerned, yes, it is a good sign that it's not increasing exponentially. The numbers fluctuate. As we know, it can range from 10 to 20 cases a day, which is still not too bad given what we know it could happen if all these measures are not in place. So yes, these numbers are encouraging, but that doesn't mean that we should become complacent at this time. We still need to continue to do what we can to limit the spread of the disease. And ideally, I would like to see no new case in the community. That's the goal. And the more we practice public health measures, the sooner we can get to our goal of having no case in our community. That's what I am looking for, and that will make me really happy to see if we come here in front of everyone and report that we don't have any new case. So that's our goal.
Okay, and just as a follow-up, I don't know if this would be more for you or the hospital, but any word lately on our PPE supply, or even maybe for the staff at the health unit, how the supply of PPE is going for them?
So I haven't heard any concerns about PPE supply. Some of the retirement home and long-term care homes, they do have some supply issues, which is being addressed by various levels of government through the Emergency Operations Center at the Ministry. I at least I can say that none of them are in a critical shortage, and the community agencies are supporting each other. Even our health unit is supporting some of the facilities if they're in short supply of something, and if we have them at the health unit, we are supporting that, and everyone is coming together to provide that. I am not aware of any critical shortage at this point.
Okay, thank you.
Any questions from Windsor?
We're still seeing a trickle of new cases every day, and in fact, it's been 7 days since we had less than 10 cases reported per day. What are the biggest sources of the continuing number of cases every day? And given that we have social distancing and have to stay home measures in place, where is this coming from currently?
So mostly what we know is the number of cases are coming from long-term care home and retirement homes. That forms the bulk of our cases right now. The essential workers that are still out there and working, and I think some odd ones is still, because there could be direct and indirect transmission. So it is still happening, and I think we just, I can say we are getting better. A lot of that is new for many individuals, many people in our community. We are getting to a point that people actually are following some of those recommendations, and we like to see that continued.
So we are still seeing community spread?
Community spread, when we define it, is basically anyone who is not directly linked with any case in the community. So some of the cases are still coming from as a result of community spread with no obvious source, but that number is going down.
Any questions from the Windsor Star?
Yes. I'm just wondering if you can give an update on the transfer of residents from long-term care to the field hospital. Have more gone there since the weekend when Marentette moved patients or residents?
So I think there has been some movement only from one of the facility at this time. There are different tables that are working. Our team is involved in some of those conversations with the long-term care homes, defining them and doing a risk assessment on each of these facilities. There is a risk when you move them. There is a risk when you don't move them. Before making such a determination that who should be moved, which facility should be moved for their residents, sick resident, well resident. So all those discussions are happening, and a risk assessment is being done individually for these homes. As of now, it's only one facility, but we are working with all the other facilities to make it happen if needed. Right now, with the additional orders from the ministry, the ability for some of the other care agencies to provide supporting to to these long-term care facilities and retirement homes, it's also helping the cause. So instead of moving people away from these long-term care home and retirement home, there is an ability now with this order to send staffing directly to those homes. And that's the first option that we are looking for. And if that doesn't work because of reasons of such as unable to cohort residents and staff appropriately given the layout of the facility, then some of those conversations will happen if these residents need to be moved to a different facility.
So it sounds like ideally you wouldn't want to move the residents unless you really had to.
That is correct, because they are there for good reason, and they are familiar with that environment. Many of these individuals may have issues with delirium, dementia, and we don't want to make it worse for them.
Thank you.
Any questions from CBC?
Yes, good morning. I'm wondering, are there benchmarks that the health unit has before you're going to recommend reopening services? Is it 0 cases, or is there some leeway there with maybe we're doubling more at 4 days? What do you have as your benchmark as to when you would recommend reopening services?
So good question, and I think some of these measures come obviously from higher levels of government in terms of their decision making. We heard our Chief Medical Officer of Health making a comment that he liked to see at least less than 200 cases a day in the province before we can restart or consider restarting some of these economy. And locally, how it will translate, we haven't got to that point yet. Ideally, as I said, I would be more interested in seeing cases go down as low as 0 or maybe even less. So depending on where this direction is coming from, what the indicators would look like from a community spread perspective, then we will be commenting on it. But as of now, I think all of us are looking at the provincial direction to basically go back to normal, whatever it would look like in the future.
Do you have what Windsor's doubling rate is now, Windsor-Essex?
We presented that information on Friday, which was more than 3 days now, and we will provide another update on this Friday, and we're hoping that it will be better than the last time, just like before.
Okay, thank you.
Any questions from Blackburn?
Just to clarify some numbers, when you talk about 26 people in hospital, I'm assuming that means the Windsor Regional Hospital and Leamington Hospital and not the field hospital?
That is correct. If you add the field hospital, it will go up more than, I guess, close to 50 people that would be classified under the hospital.
But the ones in the field hospital, they were transferred not necessarily because they need inpatient care, but because relieve some stress on the long-term care home?
That is correct. The idea is to make sure that they are getting the care that they need, and also the long-term care home facilities, if they are having staffing challenges, to ensure that moving them will provide patient care and able to follow all those IPAC measures or infection prevention and control measures, and limit the spread of the disease in the facility.
Any questions from CTV?
Thank you. I was just wondering what you could tell us in terms of concern over pediatric vaccines, children's vaccines. Is there any concern about parents not going to get those, or at least staying up to date?
Yes, pediatric vaccines, some of these vaccines are essential, and we have received guidance from the ministry as well, and we will be sharing those communication with our primary care providers to make sure that the children are getting the vaccine that they need, and so some of that communication will come from the health unit for all the primary care providers in the area.
So say there's a mother who has children who are due today for whatever shot they need, what should mom do?
Well, I think the first thing that they need to do is they should connect with their primary care provider to make sure that whether they're open, what kind of services that they're providing, and get them vaccinated. It's a risk and benefit in both the situation. We want to make sure that when these mothers are going to their primary care provider, they are doing it in a safe manner without exposing themselves or their children to anyone who may be symptomatic with COVID. So I think some of those considerations need to be in place before they go and make that visit.
Any further questions from AM 800?
No, I'm good, thank you.
Windsorite?
No, thanks.
Windsor Star?
No, thank you.
CBC?
No, thanks.
Blackburn?
No, thank you.
CTV?
I'll wait till everyone gets off the phone. Just kidding.
Thank you.
All right. Thank you. I think it is good. Thanks.
Now for the real stuff.